Hello and welcome to Frankly Speaking, where we dive deep into regional and international headlines. I speak with leading policymakers and business leaders. I am Katie Jensen. Saudi Arabia has continued to send urgent aid to Palestinians trapped in Gaza, with millions at risk of starvation after a month and a half of Israeli bombardment. The King Salman Humanitarian Aid and Relief Centre, or KSrelief, has sent more than 22 relief flights so far, carrying food, urgent medical supplies and shelter to the 1.5 million people displaced by the ordeal. On this episode of Frankly Speaking, we hear from Abdullah bin Abdulaziz Al-Rabeeah, the Secretary General of KSrelief, to ask what conditions are like on the ground, whether the war in Gaza impacts their resources in other conflict zones, and concerns about the safety of KSrelief staff following repeated Israeli attacks on Gazan hospitals, schools and aid agencies. Dr. Al-Rabeeah, thank you for joining us on Frankly Speaking. Now, KSrelief has sent more than 22 flights with urgent relief supplies to Arish International Airport and at least 2 shipments to Port Said for the people of beleaguered Gaza. Now, many countries have also followed suit, but frankly speaking, given the sheer destruction that Gaza has endured and the delay on the part of the Israelis to allow any aid in, is it too late to help the Gazans? Just how bad is the situation on the ground?
Well, first of all, I'm really happy to be with you starting with the latter part of your question, the situation in Gaza is extremely dire, actually, and the humanitarian crises are huge and tremendous, and the needs are outstanding. To answer your first part of the question, it is never too late, but the more we do, the more we put the pressure to open the corridors, the more we actually ensure that we reach those who are in need, the bigger chance to save lives. We're talking now about lives of children, lives of women, lives of elderly people. So we have to do what we can from all directions to ensure that we reach those in a timely and a quick time.
Okay, so you say it is never too late. Of course, there's lots of talks going on behind the scenes. I have to wonder, is there a limit to the number of flights or shipments that's planned for the delivery of this emergency aid, or does it only depend on the humanitarian situation that's on the ground? How do you decide how much aid goes to Gaza, particularly given the fact that KSrelief is active in helping many different other areas in need?
Well, it's a very good question. Our actually needs assessment is based on the assessment based on the ground. We are in a direct communication with the Palestine Red Crescent. We are also communicating with the UNRWA and also other UN agencies. And there is no limit as of today to how much we send. Our teams are actually also negotiating with the players on the ground and also the partners who are delivering the aid to ensure that there will be no duplication and also there is a good coordination. There are meetings happening both in Egypt and Jordan that we are part of the coordinating teams to ensure that we will continue to supply the needs based on priorities and based also on the high needs. The other question that we have teams also in Arish who are located there to coordinate with the UN agencies, international agencies, regional agencies such as Egyptian Red Crescent and also Palestine Red Crescent. And the planes are continuing from Riyadh to Al Arish on a daily basis. And also the ships are continuing. We have plans to keep those ships going on and the planes are going on to ensure that we have enough supplies close to the corridors in order to access as quickly as we can.
Okay, and I want to ask you about your work with the Egyptian authorities in just a moment. But first, lots of talks going on behind the scenes on the ground, you say. Have you noticed that Israel is trying to limit the number or the amount of aid that is actually going through Gaza's borders at the moment? What kind of numbers are we talking about? What have you seen so far? And if they are trying to limit or cap the amount of aid going through, how do you try and overcome those challenges?
Well, Kate, the situation is challenging. Personally, I have been in Rafah and Al Arish, and I have seen the Rafah corridor myself, and the challenges are huge. Starting about the obstacles that the trucks have to go through, they have to go more than 50 kilometers to be examined and cleared by the Israeli forces, and then coming back 50 kilometers. And also the assessment takes days in order to clear each truck. And then they have to go through the Rafah corridor. This by itself is a significant challenge, and it's delaying the aid for those who are in extreme needs. The second, also the number of trucks that are allowed. Many trucks that have been kept for days to be cleared, and even ambulances. We have more than 20 ambulances sitting at Rafah corridor now for over days, and hoping that those will be cleared and allowed to enter Rafah. As far as I know, that during actually the periodics of ups and downs, the trucks that are allowed to enter between 50 to 140. And as you know, Kate, and as I know, that the needs are far beyond those numbers. From the UN itself, we have heard from the Under Secretary, a minimum of 400 trucks a day is the bare minimum to allow life to go in Gaza.
Okay, so let me ask you about that, because you say that Israel is causing big delays when it comes to being able to receive and access that aid. I have to ask, how much aid is potentially going to go to waste? Again, we're talking about food, we're talking about urgent medical supplies. So with these delays, there comes food waste, but also how many lives are at risk? When we're talking about tens of thousands of people who have been injured, how many livelihoods are at risk with these kinds of delays?
Well, we know that there are thousands of people. If we talk about children, and we know over hundreds of thousands of people have moved from the north to the south, and I would say easily half of them are children. We have also women who are at risk, pregnant women who are at risk. We have elderly people who are at risk. We have, as you mentioned, civilians who have been injured, and they need to be also treated, and also their injuries have to be secured so that they don't get infected and they don't die. We're talking about life by the minute. So any delay means, as far as I'm concerned, as a doctor, means a risk of death. So we have to gain every minute, we have to gain every hour, and we have to allow as many trucks that are carrying nutrition for children, food for adults, and also medications that will maintain life, and we should not forget the food.
Okay, so you say countless lives are being put at risk because of these Israeli delays. Well, let's talk a little bit more specifically about some of your work on the ground, because you recently finalized 4 joint cooperation agreements with a number of international organizations to provide relief worth 150 million Saudi riyals. That's about 40 million US for the Palestinians who are trapped in Gaza. What is that money mainly spent on, and what roles are the international organisations playing? Where exactly do they come into the picture in the land, sea and air relief bridge that Saudi Arabia has proposed?
Well, Kate, our aid is as you rightly mentioned, it's through many ways. Number is the bilateral, which is being carried by the air bridge and by the sea bridge, and thereby being carried by the hundreds of trucks to Rafah corridor. But that's not enough, and we know that's not enough. So we have signed 4 agreements with UNRWA, WFP, WHO, and ICRC, hoping that those diverse UN and international agencies will be able to use the money for urgently to, first of all, feed people, feed children, save lives, and ensure that the bare minimum medical services are being provided. Some of the agencies have requested, in addition to the money, also in-kind donations. We had meetings with them, and they have sent their priorities, and those priorities are being now delivered to Rafah corridor to ensure that those agencies will receive in-kind donations based on their priorities, to ensure that will couple also the funding that they have received. And our aim is to ensure that those who are in dire need will receive it quickly and as quickly as we can, whether through us directly or through our also UN and international partners.
And of course, with more than 1.5 million people who've been displaced in Gaza, this aid is so urgent. Now, you've also signed a memorandum of joint cooperation with the Egyptian Red Crescent Society to provide important logistical support and deliver humanitarian aid to Gaza. How helpful were the Egyptian authorities and the organisations in helping to facilitate your work?
Well, Kate, I have to say this openly and frankly, that the Egyptian authorities have been very cooperative. They have been instrumental to our work, and they have helped us a lot, either at the port of Arish or at also the seaport of Port Said, or also the Egyptian Red Crescent in the transport from those locations to Rafah corridor. And based on that, and when I visited actually Arish and Rafah, I have seen, Kate, the amount of logistics burden that the Egyptian Red Crescent has. And we had a meeting with them, and we were actually happy to sign a memorandum of understanding to support them with what we can to ensure that they will have both the technical, the equipment, and also the manpower capacity that will also couple their work so that they will be able to deliver in a much more speedy way.
So clearly a successful visit there to Arish. I know you were visiting the Centre for Logistics Services of the Egyptian Red Crescent. I have to wonder, do you have any plans for either you personally or for other senior officials from KSrelief to visit Gaza in person to show your support or oversee the important distribution of aid there?
By all means, if the security situation allows, certainly myself or my team will be more than happy to go in Gaza, ensure that those people who are in dire need will receive the aid. We want to see also that the distribution is appropriate. And by the way, Kate, we were in a virtual meeting, actually multiple meetings with the Palestine Red Crescent and also UNRWA to ensure that that their also logistic needs are met, and certainly visiting them on the grounds will add value to them and to us.
Now, of course, the delivery of this aid is only possible with the funds that you're able to raise. You've had a lot of success in this so far. I believe that specifically the Gaza Aid fundraising campaign that's taken place on the KSrelief affiliated Sahem platform, that has exceeded $143 million. Now, King Salman himself, he made an $8 million donation. Crown Prince Mohammed bin Salman, he donated $5.3 million during the campaign's launch. Incredible figures. How would you compare that amount with previous fundraising drives that you've undertaken, particularly given that some cynics in Israeli media, they've always said the Arab world doesn't really care about Gaza? Do you feel like you're proving them wrong here?
Well, Kate, I think nobody can deny the evidence and the numbers. And I think the Sahem platform is seen by the world. The response of the Saudi government and our leaders are very clear. The custodian of the two holy mosques, Crown Prince, started this campaign, and the people of Saudi Arabia have followed. you are right that we have exceeded $140 million, but we haven't stopped yet. The platform changing on the hour, and I'm sure if we look at it on a daily basis, we'll see that this fundraising platform is changing. And we thank those who have participated. By the way, this is one of the largest and the quickest fundraising campaigns that we have ever done. Not only the number of the amount, but also the number of people who have participated. We have exceeded 1 million donors, which is a big number when you have a fundraising. To have 1 million donors, that reflects the response of the people and their passion about the civilian situation and the humanitarian situation in Gaza. I'm sure those numbers will increase tremendously in the coming days and weeks. But the most important is not the numbers. The most important that we want to see also those numbers reflect on the ground. Let me also bring something which is not clear on the Saham platform. We have also from the businessmen of Saudi Arabia in-kind donations. Our businessman has donated ambulances, medical equipment, food supplies, nutrition and formula for children. These are not reflected on the platform. So we're talking about a lot of donations, but let's plea and let's ask that we should open those corridors as much as we can and not rely only on Rafah corridor, but we have to see also other corridors are open and we reach those who are in need in Gaza. And let's all plea for saving the lives of children, women, and elderly people, so that the time is very precious and very important.
So clearly incredible donations financially, as well as things like medical supplies, ambulances you mentioned there. But the big issue is that the safety on the ground for the delivery of this aid is not guaranteed. It feels like the war in Gaza has been marked perhaps more than any other conflict in recent history, that with these deliberate attacks on hospitals, aid convoys, medical teams as well. How would you describe such attacks? And have you received any guarantees about your own personnel and equipment?
Well, Kate, I am a humanitarian and also I am a doctor who still practice and try to save the lives of children on daily basis. So it is for me pain to see anybody attacks and deliberately actually kills aid workers or health workers or attacks hospitals or even mosques, churches, and you name it. Those acts are actually against all rules that we know of, against the international humanitarian law, against also the principles of human beings. And we hope that those attacks will stop immediately and no civilian or health worker or humanitarian worker is attacked or targeted. Saying that, certainly we are worried about our staff, we are concerned, and if safety is guaranteed, Kate, you will see not only KSrelief staff are in Gaza, but we are ready to send health worker volunteers who have already registered in the platform for volunteers at KSrelief, willing to go and put convoy volunteer camps to save lives of those who are in need, especially women and children.
So clearly these health workers cannot be sent because you can't guarantee their safety. And we're also seeing your work impacted in other ways. Besides the Gaza emergency aid, we know that 112 development projects are currently being implemented by KSrelief at a total cost of $369 million. But I have to wonder, are they at risk because of the war in Gaza? How many of them are in the West Bank currently?
Well, some of them are in Gaza, some of them are in the West Bank. I'm sure those who are in Gaza, we have to do the assessment and to know what happened to them. But certainly they must have been damaged by one way or the other. In the West Bank, we have also our developmental projects, including health facilities and schools and others. all of those, I'm sure they are at risk. And this is actually is painful for us and for the donors who have donated the money, whether it's government or also businessmen or lay people. It's very important that facilities which provide services for the civilians should always be protected. What is happening in Gaza is beyond even imagination, what we see in Gaza. I was talking actually to the commissioner of UNRWA, and he himself, he lost over 120 staff from UNRWA, and he has lost schools, and he has lost facilities that we have donated ourselves. We have supported UNRWA for years. We are one of the top donors for UNRWA. And if he loses the facilities, we have lost what we have built for years in Gaza or in the West Bank.
So does the conflict in Gaza take away any resources from your other commitments in places like Yemen, Sudan, or elsewhere?
Well, no, we have actually offices in those countries. For example, we have 3 offices in Yemen. We have our staff on the ground. We have also our staff in Sudan, and we have our staff in Somalia, and you name it. And we have staff in Jordan for the Syrian refugees. So we did not actually stop. Maybe the media attention has changed, but on the ground, I can assure you and assure everybody that we are continuing to provide the aid and the developmental work that we are doing. We do not want to see that one crisis will actually affect the other crisis, because loss of life or delay of the humanitarian supply is something that is not the practice of KSrelief.
And the work you're doing in Gaza is clearly making a huge impact, but that's not all. You've spent more than $6 billion around the world over the past 8 years, places like Yemen and Sudan, and it's really positioned Saudi Arabia as one of the world's most generous and fastest humanitarian responders. Yet for some critics, feel like the kingdom can never do enough. But if we put things in perspective, how does Saudi actually rank among world countries in terms of the aid work that it carries out?
Well, you have said it, Kate. We are always on the top 3 top donors. And if you look at the OECD DAC last year, we are the top developmental donor globally. If we reflect this based on GPD, we will always be number 1 in the last actually decade or more. So Saudi Arabia is actually one of the top funder and donor when it comes to both humanitarian and developmental aid. And anybody who questions this should look at the UN actually FTS platform, OECD platform, or actually IATI platform. Those are not our platform. Those are the UN and the international organization that actually document aid, and the answer will be seen by those platforms.
Clearly making an incredible impact around the world. But Dr. Rabeeah, just before we go, I want to ask you a little bit something off topic. Before doing this job, of course, you were a health minister, but I was very interested to discover that prior to that, you made quite a name for yourself as one of the most prominent and successful surgeons, specializing in the very delicate operations of separating conjoined twins. What can you tell us about your personal success rate in these highly complicated surgeries? Would it be fair to say that the kingdom is now the world's top destination for these kinds of operations?
Well, Kate, thank you for raising this point. This program, which is a national program supported by the custodian of the 2 holy mosques and Crown Prince, started in 1990. And by the way, it is still going till today. I have another surgery with my great team to be done in a few weeks from Nigeria. This program, which is called the Saudi National Program for Conjoined Twin Separation, is one of the largest in terms of volume, and also one of the highest in terms of success rate. As of today, we have actually evaluated over 134 sets of conjoined twins and separated including the one coming in a few weeks, which will mark number 60 set of conjoined twins from 24 countries, with a success rate approaching 100% when we talk about surgical success rate. And this is actually, as far as I know, is the highest globally. Since you mentioned it, Kate, let me tell you a painful story. In 2018, I separated a parasitic twins from Gaza Strip, Haneen, who has another incomplete set of twins, which has been separated with a long surgery. And we brought a smile on the face of the parents of those twins. And we managed to take the twins back to Gaza in 2018. Now, I am not sure as of today whether Haneen is alive, whether her parents are alive, or all of this work that has been done by Saudi Arabia has been lost. It's painful for me until I secure that Haneen and her parents are alive.
Well, let's hope that you do hear from her. I have to say, 134 twins is just an incredible number. What a massive, success for not only you and I think Saudi Arabia, but certainly, for 24 countries you mentioned around the world, changing lives. That is indeed for sure. Dr. Rabeeah, thank you so much for joining us today, sharing the details with us of your important work in Gaza. We wish you the best of luck in carrying out this urgent aid operation on behalf of KSrelief. Thank you for joining us today on Frankly Speaking.
Thank you. Thank you, Kate.